Let's talk gout, shall we? Don't look at your papers. Look at me. Thank you. What is gout? An inflammation of the joints due to what? What's the patho? Some's got to be building up in there. Yeah. It is great toe pain. It's a waste. What waste product is built up? No, uric acid. Uric acid. All right. So gout is an inflammation in the joints due to a buildup of uric acid. What is uric acid? One may ask.
We've been over this.
Yeah, lots of times. Yeah. It is an acid. Is it a good acid or a bad acid? It's a bad acid. It is a byproduct of protein breakdown. One of the ones of protein breakdown. So our body naturally produces lactic acid, and when we eat things, lactic acid, uric acid. I can't get myself straight today. I think I need a burrito because I've made two mistakes today. I know I need, okay. So uric acid, it is a byproduct of all kinds of breakdown in our body, but mostly proteins, okay? So they used to call this disease like the rich person disease, because way back in the day, people that were poor couldn't afford meat, right? That was like a delicacy, right? You would eat just like what's on the ground, roots and things like that. So only royalty could eat meat and drink alcohol, like wine and things like that. Well, the byproduct of proteins and alcohol breakdown is uric acid. Okay, now where's uric acid supposed to go to be broken down? It goes to the liver breaks it down, and then it sends it to the kidneys as, do you think the kidneys want to pee straight acid? No. Urea. Okay. So if you have too much uric acid, though, what kind of pressure do you think that's going to put on your liver? I know. And so that uric acid got to go somewhere, right? So in this case, it likes to build up as crystals, kind of like when you talked earlier about excess calcium will bind up together and form kidney stones. Excess uric acid binds up together and forms crystals. Then it's like, hey, where's a good place for me to live? I know, your big toe. And so it goes into the big toe, and you have these massive crystals that deposit in there. Well, your great toe is going to say, something is wrong, and it's going to bring a massive amount of inflammation. And this happens in all your joints, and that is gout. Okay. All right. The crystals are called tophi, and they love to test on the word tophi, which I hate that word. I don't know why, it just sounds so nasty. Yeah. Tofu and also fungus. So it's like toe fungus, tofu. Yeah, I don't know. It's nasty. Anyway, those are the stone-like deposits. Okay, so let's figure out who's at risk and why. Patients with liver disease, why would they be at risk of gout? They can't get rid of uric acid. Why would kidney patients or patients with kidney disease be at risk of gout? They can't get rid of the urea. Good, everyone. Heavy alcohol use. Inflammation. Okay, so part of it is the liver is very damaged in heavy alcohol use, which means they can't get rid of uric acid. But drinking wine and some of those things can cause uric acid buildup as well. Increased meat intake. Uric acid is a byproduct of meat. There is a genetic component to gout where your body just naturally cannot get rid of uric acid, and it makes too much uric acid. And then a high sugar diet. Okay, where would this come from? Stop it, all of y'all. Okay, so let's start over. When you take in a bunch of sugar, what does your body do with it first? What's the first thing it does with it? First thing is it's going to use it for energy. Anything excess, it goes to the liver and it turns it into glycogen. Well, it can eventually turn it into glycogen. Okay, let's walk through it slower. All right, so when you take in carbs, your body will use it immediately for glucose and ATP, right? Okay, any excess goes into your giant tower in the liver of sugar storage, yeah? Okay, when that tower spills over, like you had too much sugar and too much, even the tower is full, it's going to spill onto your liver and turn into fat, and that's how you get fatty liver disease. So if a patient has fatty liver disease, can they break down their uric acid? No. So that's where your high carb intake is going to come in. Okay. There are 4 different phases of gout. The first one is asymptomatic. Your body is starting to build up with uric acid, but you don't have symptoms yet. Okay. Number 2, acute. You have this massive primary gout attack. Okay. So all your joints are hurting, especially Your great toe. Y'all show some respect to this toe. It is the great toe. Okay. And then number 3 is intermittent. So then you're going to keep having these gout attacks over and over again, depending on what you're doing, right? You go to the rodeo, you ate, 7 turkey legs, you're going to have a gout attack. Okay. You went to the Super Bowl, you drank too much, you're going to have a gout attack. Okay. And then it goes into number 4, which is chronic. And that's where your body just cannot get rid of the uric acid and it has continuous symptoms that you cannot get rid of. Okay. All right. So let's talk signs and symptoms. What do the joints look like in gout? They're angry. Yes, they are very swollen and angry and painful and red. And you may have a low-grade fever because inflammation. And you may have pruritus. What is pruritus? It's buildup of uric acid. Well, pruritus means itching. You're right. The patho is from uric acid buildup underneath the skin because that uric acid's got to go somewhere. Who else did we see pruritus from uric acid buildup in? Huh? I just didn't hear you. Liver patients will have pruritus from uric acid and chronic kidney disease. Okay. Renal calculi. Why might patients get kidney stones? Uric acid stones, right? Those crystals or tophi, some may say, okay, are going to build up. And then they're going to get random gout attacks, right? And limited range of motion of that joint because it is so swollen. The pain is worse at nighttime because we typically tend to overdo it at nighttime, right? We go out to the bars on Friday nights. Okay. Watch yourselves. Okay. All right. So how do we diagnose it? Well, we're going to draw their uric acid levels. That's easy. Yes. We'll do a 24-hour urine collection to see how well your body's able to get rid of uric acid in a 24-hour period. Okay. Then we're like, hey, I kind of want to see what's in those joints. So they're going to stick a needle in it, pull out some fluid, look at it underneath the microscope, and guess what they see? Tophi. Okay. That's called a synovial fluid analysis. Obviously, their ESR and CRP are going to be elevated because this is a massive inflammation, okay? And you need to check their liver and kidney functions to see, is that what caused the problem in the first place? Do they have liver disease we haven't diagnosed? Do they have kidney disease we haven't diagnosed? Okay? One of the biggest things you have to encourage your gout patients to do is to increase their fluids to 2 to 3 liters a day. Why would I tell them that? Let's flush it out. Let's flush out that uric acid because if they've got a bunch of uric acid and then all that uric acid's going to the kidneys, what's going to eventually happen to their kidneys? RIP. Yeah, kidney stones, kidney damage, kidney disease, right? And they need to go on a low purine diet. What is a low purine diet? Okay, like what? Purines you can think of as meats, okay? So you need to decrease especially their red meats because that's what's notorious for having uric acid. Okay. No alcohol because it's a toxin. It can cause liver damage, which I need their livers working like real good to get rid of this uric acid, right? And alcohol also has uric acid, right? Elevate and wrap the affected joint. Okay, so we don't ice it really because you're just going to basically freeze the crystals, but elevating and wrapping it would be a very good idea, right? To try to decrease the inflammation. And then as far as drugs, first we're going to say, hey, take NSAIDs every day to decrease that inflammation, okay? The most common NSAID for gout is called indomethacin. That's often on test, okay? All right, and then we're going to do corticosteroids and exacerbations. What does this sound like? Where you do daily NSAIDs and then corticosteroids and exacerbations? Autoimmune disorders, right? And so it has kind of autoimmune-like properties, but it's not considered an autoimmune disorder. Okay. And then we can add either colchicine, allopurinol, or probenecid. Those are your 3 gout drugs. The only one that treats an acute gout attack is colchicine. You with? Do we understand gout? Cool.